I like to think about the heart primarily as a muscular organ. It's a muscle, and like any other muscle in the body, the function of the heart is to be able to contract and relax. Or sometimes I use the term squeeze to get the blood out into the body, and then relax or expand to get all the blood that the body has already used up in terms of oxygen and energy, receive it back so it can just pick up oxygen again in the lungs and then pump it to the rest of the body again. So again, function of the heart is to just pump and relax and pump all the blood to the rest of the body. So that's the job, contraction and relaxation. Now, like any other muscle in the body, it requires blood flow so it can have energy to contract and relax. So these structures, if you can see on your screen, are the vessels, the blue and the reds on the heart muscle itself, supplying the blood flow to the heart. Very similar to like a building or a room where you have a foundation, which are the walls of the building, and then you have the plumbing that supplies the water. So the plumbing of the heart are the vessels in the heart. And then there is electricity, which makes sure that the heart is beating in a rhythmic fashion and it's able to contract and relax in sync with all the chambers that it has. So a normal heart beats almost 70 to 100 times per minute to get the blood flowing to the rest of the body. That's the basics about the function of the heart and how is it supposed to work. Next slide, please. So when we say that there is heart failure, what we're trying to say is that the heart is not able to do its job or it's struggling to do its job. So if it's too weak to pump the blood to the rest of the body, or if it's too stiff to relax and get the blood back into the heart, so unable to receive the blood, it's not doing its job. So it has to be able to do both in order for blood to get to the rest of the body. So anything that makes the heart not able to pump or not able to relax would result in a struggle for the heart to pump. And that's the term we use to describe heart failure. Next slide, please. Now, this is just a picture kind of talking about the same thing. So if the heart is weak, it dilates out and the chambers in the heart start to enlarge. So the bottom right side is the example of a dilated heart or a weak heart. Just like an elastic or maybe a trouser pant elastic that you wear for a long, long time, and it just loses the elastic fibers and becomes very floppy and is not able to do its job anymore. And the other flip side on the left lower quadrant is a thick heart muscle compared to the normal, which has less cavity left, and it's so stiff that it cannot relax and cannot receive the blood back. It presents the same way clinically if it's not able to pump the blood forward or not able to receive the blood back. Next slide, please. And that brings us to this whole types of heart failure. You guys must have heard congestive heart failure with reduced EF or congestive heart failure with diastolic dysfunction. And they make up around 50% each of the patient population now. So if you randomly see people who have congestion because the heart is not functioning, half of those people would have a weak heart and another half would have a stiff heart. Next slide, please. Now, just because I'm a heart doctor and a heart failure doctor, I see a lots of patients who have heart failure. But in the general population, it is the most frequent cause of a hospital admission in people who are above 65 years of age. And each year we see more than 500,000 new cases of heart failure. And heart failure in some form or other contributes or directly results in deaths of about 300,000 people per year. So a huge disease burden. Also, as the life expectancy has become better in the last 100 years, people are going to be living longer because there are more treatments available to improve survival. So we will continue to see more heart failure in terms of prevalence will grow as the years go by because the population is going to be older and it's going to age with lots of comorbidities. So we're going to see more heart failure in years to come. Next slide, please. In the people between mid-40s to mid-60s, this disease is more prevalent in men compared to females. Kind of goes hand in hand with smoking is more prevalent in men compared to females in this age group. High blood pressure is more common, and coronary artery disease is more common. So all the diseases that affect the heart are more common in men in this kind of middle age group than females. So you tend to see more heart failure in men. Next slide, please. So yeah, we can go to the causes. There are lots of terms that we kind of use loosely to describe heart problems, and I'll briefly kind of go over them here. When somebody says that they had a heart attack, that does not mean the heart is stiff or heart is not able to do its job. Heart attack itself means that there was a problem with the plumbing in the heart. So the vessels that supply the heart had some blockage that temporarily stopped all blood flow to the heart. And as a result, a part of or the whole muscle wall of the heart died. So heart attack means no blood flow to the heart temporarily with resultant damage to the heart muscle. Now, this is one of the common causes. If the heart damage is permanent, that part is going to get weaker and cause heart failure. So heart failure can be an aftermath of a heart attack, but they're two separate things. The common causes of a weak heart or a stiff heart are high blood pressure, untreated for a long time or suboptimally treated, high cholesterol. People who use IV drugs can introduce infection into the bloodstream that can damage the heart, so infections in the bloodstream. And then toxin exposure. So some of these toxins are things that we can avoid and the others we cannot avoid. So common examples for toxin-mediated heart damage are drugs like alcohol or amphetamines or ADHD treatment or cocaine, just drugs of abuse. And sometimes we consider chemotherapeutic agents as toxins too, because they're very potent medicines, like for breast cancer, for example, that can make the heart muscle weak. But in that case, that requires very close monitoring of the heart muscle to make sure it's not getting weak, and we don't need to go to the alternative therapies for the cancer itself. So there are lots of causes. Next slide, please. But the common ones that I want all of us to be aware of, which are most of them are modifiable, are coronary artery disease, which is the plumbing problem with the plaque buildup in the vessels from cholesterol, uncontrolled diabetes, high blood pressure, smoking, again, increases the risk of heart attack and then causes heart failure, being overweight, having cholesterol levels that are not under control. Some of the things that are not in our hands are, of course, our age, our family history, and our gender that we cannot change as risk factors, but most of the other risk factors are modifiable. Next slide, please. So is this a disease that is preventable? Absolutely, yes. So the bottom line is just a healthy lifestyle. So anything you can do to keep your weight stable, not get overweight, keep your blood pressure stable, not get hypertensive for extended periods of time, avoid smoking, exercise regularly, just stay healthy in general. So healthy lifestyle goes a long way in preventing almost, I would say, 70% plus of the heart problems with just healthy lifestyle. Next slide, please. Now, what are the common symptoms? What are the things that if you feel you need to think about? Is this my heart? The most common thing that initially starts where most of us just rub it off and don't think much of it is shortness of breath with exertion or lack of energy. For example, I used to be able to climb one flight of stairs without huffing and puffing. And now it takes longer to catch my breath, or I have to sit down to catch my breath. Or I have to drink a sip of water to kind of just get my breathing better. So whatever you were able to do before, and all of a sudden, or gradually even, that you're not able to do anymore just because you have no energy or you do not have enough breath, can be first sign of heart failure. Lots of people, by the time they come to me or a heart doctor, they have lots of fluid retention issues like leg swelling or a cough that is worse at nighttime when they try to lay flat in bed. They just have to sit right back up because the cough worsens at nighttime. Now, a cough worsen at nighttime could be a sign of just reflux from the stomach as well. But in talking about the overlap syndrome, heart is definitely right up there. A cough that is bad at nighttime, think about the heart. Some people just tend to retain their fluid in their belly. So they would have early satiety. All that means is, I just had 2 bites and I don't feel like eating anymore because my tummy is full, or I feel bloated, or I have a feeling of heaviness in my bowels. So that can be a sign of heart failure as well. A weight gain without eating more can be a sign of heart failure because you're retaining fluid weight and not a real weight. Decreased appetite, not able being able to eat well. And then in the later stages, when the heart is really bad and there is not enough blood flow to the brain, people can feel a little foggy in their head, a little confused, just not sure what's going on. But that's usually a late sign. Or all of a sudden they start to feel very cold all the time and they cannot bring their body temperature up despite using lots of coverings and sheets and blankets, etc., just because there's not enough blood flow. Very, very late signs for heart failure are kind of purplish fingertips as well, not in the cold weather necessarily, just signs of not having adequate perfusion to the body. So early sign again is just having decreased energy or decreased stamina or getting short of breath easier. Now, I know this is a little tricky thing to talk about during this COVID era, for like last 6, 7 months, most of the people have stayed at home and they have not been exercising. So how do you tell this apart? Is that I'm out of shape and that's why I'm getting short-winded? Or is that my heart has gotten weak or stiff and I'm getting short-winded? I would say it's probably better to get checked out, even if you think like you're out of shape and that's what's going on. It's just better to be safe than sorry. Next slide, please. So if you do have these signs or symptoms, go see your doctor, and your doctor will check your blood pressure, will weigh you, examine you. They will likely get an EKG, a chest X-ray, and they will ultimately get a heart ultrasound known as echocardiogram to actually see the heart chambers, make sure that the heart is not weak or not stiff, and that's the cause of your symptoms. Next slide, please. Just an example, just showing heart ultrasound, non-invasive. All we take is external pictures of the heart. Next slide, please. And it shows a black and white, really nice picture of all 4 heart chambers, and we can see if it's a squeeze problem or a relaxation problem. It also tells us about the heart valves, make sure they're okay, and there is no leaky valves or tight valves in the heart. So it gives us lots of information just doing a non-invasive heart ultrasound. Next slide, please. Now, once we do identify someone who we think has heart failure, especially if the heart is weak, we put these people on medicines that help the heart recover the squeeze function. So for weak heart, we have certain sets of medicines that we try to put everybody on. One of the common examples is just lisinopril, which is a very common blood pressure pill. It's an ACE inhibitor. And then a second class are beta blockers like metoprolol or carvedilol that decrease the working of the heart, and then spironolactone. There are a couple of other medicines that we use as well, but the basic cornerstone are at minimum, these 3 classes of medicines. Some of you might have kind of seen commercials about this medicine, Entresto, in TV for past couple of years now, which is kind of the newest and the best medicine we got for heart failure that came like 4 or 5 years ago. So all these medicines help the heart heal. Heart failure is only one condition. that I would say, I use the term, time is not the best healer. Medicines are the best healer. So we know that these medicines improve survival. They make people live longer. You would probably not tell a difference in symptoms right away. It takes a month or so for the medicines to start acting. Next slide, please. One of the cornerstone medicines that we use to get the extra fluid off of the heart are the fluid pills, like we call them diuretics, like Lasix, which makes the body get rid of excess fluid. Now, that is a medicine that doesn't improve, that doesn't make people live longer, but it's a symptom control medicine so they can breathe better because there is no extra fluid in the heart or in the lungs, so they can go farther. The important thing that you guys can do if you're on a fluid pill is to make sure you weigh yourself every day, make sure you're not retaining any extra fluid, check your blood pressure every day, and avoid the foods or the drugs that are going to make you retain sodium or fluid. For example, NSAIDs like Advil or Motrin or ibuprofen, or eating outside or eating canned foods. So lots of canned soups have tons of sodium or salt to preserve the food. And if you eat that, that has almost like 900 milligrams to 1,000 milligrams of sodium. That's going to make you retain fluid. So be wise about watching the salt and fluid intake so that you can function better if you do have a tendency to retain fluid. Next slide, please. Now, some people with weak heart, they require a defibrillator. So when the heart becomes weak, it can kill a person in two ways. A person can die from a weak heart because there is not enough blood flow to the rest of the body, the body systems start to fail, they start retaining fluid. So that's one way of just having a really, really bad outcome or not surviving a weak heart. The other thing that can happen that can be a fatal issue in people with heart failure is a bad heart rhythm. So the heart can just go out of rhythm, and that rhythm just can kill people. So after 3 months of optimal therapy, if the heart function doesn't improve, then we refer these people for a defibrillator, which prevents the death from heart failure just from the rhythm perspective. It doesn't do anything to the risk of dying from a bad heart itself or from fluid or from lack of perfusion, but it does help with preventing death from rhythm issues in a weak heart. Again, this is not a treatment for where the heart is not weak. It's just a prevention therapy that we do for people whose heart are weak. Next slide, please. So once you have seen a heart doctor, you're on the right medicines, the chances are if we find a cause why the heart is weak, hopefully we can fix the cause. If it's a plumbing problem, we can do an angiogram, open up the clogged up vessels, put a stent in, sometimes do a bypass, and that hopefully would make your heart get better. If it's an uncontrolled blood pressure issue, we can control the blood pressure. So if we identify a cause, we can most of the times treat the underlying cause or avoid the toxins that cause the heart failure, and the heart will get better. But sometimes there is permanent damage to the heart muscle, and no matter how hard we try, the heart does not get better. And a sign of a failing heart, despite adequate medical therapy, is progressive lack of energy, not getting better, frequent ED visits or hospital admissions, just being disabled, not able to eat, weight loss, becoming skin and bones. All of these are markers of a failing heart that's not getting better and is going in the wrong direction. Next slide, please. And when that happens, we do have some options. First of all, your heart doctor or your primary care doctor may decide to refer you to us. Like I said, we're the heart failure docs. I'm one of them. And we can sometimes kind of think about other options, like doing more invasive testing, see if we can put people on medicines which are specialized heart medicine. So I would like to use an analogy here. See if you have a horse carrying a cart and the horse is really weak, all the medicines that we use are trying to unload the horse. So So you take the weight off of the wagon, or you just detach the wagon so the horse can go farther. But sometimes you have to whip the horse as well, which doesn't make the horse stronger at all. It just makes it go a little farther. So those specialized medicines that I use the analogy of like whipping a very weak horse are specialized medicines that sometimes we can use in the hospital through IV lines and send people home on IV lines as well. So there are some therapies that we can think about once the heart failure is so bad that it's not being managed well enough with oral medicines alone. Next slide. Sometimes we decide to put specialized, next slide, please. Sometimes we try to put specialized heart pump in the heart. I don't know if in your community you have met someone or seen somebody who has a pump in their heart. So this the middle picture kind of shows a heart pump surgically attached, which just does the job of the heart for the heart. It takes the blood out of the heart and pumps it to the rest of the body. So sometimes that's an option for some patients. And sometimes they need a new heart. Next slide. When the heart is so bad that no matter what we do, it's not getting better, it's probably time to think about a new heart. Now, that's a discussion for a whole different day. Who are the people who we think will benefit from a heart transplant? It's not something that's on the shelf and you can grab it. So it's a very, very big undertaking thinking about heart transplant. But this disease is serious, heart failure. It can kill people. It can just have a really bad impact on quality of life. Just know that there are options, but the best options are identifying it early, putting you guys on the right medicines so it doesn't go to the point of no return where we have to think about invasive therapies. Next slide, please. If you guys want to kind of do a deep dive into heart failure, there are lots of resources on the American Heart Association website and American College of Cardiology website. Heart Failure Society of America have also lots of good patient resources about watching your salt, fluid, keeping a log of your blood pressure, what medicines are used for what kind of condition, what are the side effects. So lots of resources there if in case you guys wanted to do a deep dive if one of you or a loved one is suffering from this disease. Next slide, please. And I know I've kind of made it sound like a serious problem, but the upshot is once you know what you're dealing with, you can do something about it. And just a change in the lifestyle, a healthy lifestyle, walking 30 minutes per day, trying not to get overweight, watching the salt, watching the grease, or just cutting down on the fried food, just having a healthy lifestyle, not smoking, asking other people to stop smoking around you. That goes a long way. It's cheap, it's free, the lifestyle change. So just know there are things that we can do now that will help us in the future to avoid this disease. God forbid, if you do end up getting this disease, there are experts in the field. Most of the times we can identify the cause and help the people get better from this disease. And if we cannot find a cause or cannot fix the cause and we're at a point where the medicines are not working, just know there are other options available. That would be it from me. And I'm happy to take any questions if you guys have any.